Hi, Devin West here with Medicare Savings Solutions. In this video, we'll go over the 3 biggest mistakes people make during the Medicare open enrollment period. First, I'll remind you what the Medicare open enrollment period is, and then we'll go through the mistakes. So the Medicare open enrollment period is a time frame every year from October 15th through December 7th when you can change plans for the following year. You can change from a Medicare Advantage plan to another Medicare Advantage plan, a Medicare Advantage plan to a prescription plan and a Medicare supplement, or from a Medicare supplement and a prescription plan to a Medicare Advantage plan. So there are many different changes that you can make at that time to make sure that you're taking care of the best you can be for the following year. So the first big mistake people make during the Medicare open enrollment period is they don't review their options every year during that time. And the problem with that is because a lot of times you can have huge increases in premiums or co-pays, co-insurances. You can lose doctors because they go out of network, that kind of thing. And so you really want to make sure that you take a look at all your options, because if you don't, you may mess yourself up for the following year. If you have huge, co-pays, increases, co-insurances, and that kind of thing, you may have to pay much more out of pocket when you go to the doctor, hospitals, surgeries, that kind of thing. And you don't want to have that be a surprise if you can avoid it. So take a look at the options there. And then also, if you lose your doctor, that can be a huge problem too, because then you lose the ability to get referrals if your plan requires it, or prescriptions. And you want to make sure that your doctors are all going to be in the network for the following year so that you don't have any of those problems either. So again, that is one of the biggest mistakes people make during this time, and I'll tell you how to avoid that later on in the video. So the second mistake I see a lot of people make every year during the Medicare open enrollment period is that they get a plan because someone they know said that that plan is great for them and that they should get the plan too. It may sound like a good idea, but in reality, it may not be, because everybody's situation is a little bit different. You may have different doctors, different medications, different finances, health problems, all kinds of things that can make that a bad decision if you don't go through all of your options and make sure that that plan or another plan might be best for you for the following year. Because the best plan for you may not be the best plan for your brother, your sister, your mother, father, neighbor, or even your spouse, or whoever told you that the plan is a good idea for you because it's a good idea for them. So you really want to be careful and not make the mistake of basing your plan selection solely on what someone else said was good for you. The third and biggest mistake I see people make is they get sold a plan that wasn't right for them. So don't get sold. I get calls from people every year saying that they switched plans because of a $5 difference in co-pays or premiums, or something that looked really nice to them at the time, but the plan was missing things like doctors or the service that the other plan had before, and it really messed them up for the following year. And so they call me all the time trying to switch plans, but really they can't until the next year. So they end up switching back and forth between plans, and it really makes it harder for them to have to deal with different plans every year and different doctors, prescriptions, and everything like that. So you want to be careful and not get sold a plan. Sometimes it's hard not to get sold a plan because you get bombarded with all kinds of information from everywhere, by mail, phone calls, people knocking on your door, all kinds of things that make it really enticing to change plans, or you get pressured into another plan or something like that. So to avoid that, there are a couple different things you can do. You can try to call each and every company that's available to you in your area and compare yourself which plans that are might be best for you for the following year. Or you can talk to an independent agent instead of a captive agent. What that means is that an independent agent is an agent that can represent many different plans and many different companies and help you decide which plan might be best for your situation. A captive agent is an agent that can only represent one company or one plan, and they're going to tell you that that plan is the best for you because that is their job and that's how they get paid. Not necessarily a bad thing if the plan is a good option for you, but it really limits your ability to choose a plan that might be best for you. At Medicare Savings Solutions, we are independent agents and we represent all of the top plans and all of the top companies, and we do a complete review of your current situation to make sure that you get the plan that is best for your specific needs. We take into account your doctors, your prescriptions, your finances, and your medical issues to make sure that you get a plan that is going to be the best for you for the following year. Our services are free and we are completely unbiased. We don't care which plan you go with as long as it's the best plan for you. So if you'd like free help during the Medicare open enrollment period, you can call us at 1-800-663-5707. And if you'd like to check out our other videos, you can see those on Facebook or YouTube or our website just by searching Medicare Savings Solutions.